So let's get started on to the next talk. Great pleasure to welcome Dr. Kieran Collison from the NHS. I'm going to talk about long COVID, the NHS plan for 2021-2022. Kieran is chair of the National Long COVID Task Force. She's GP in Oxfordshire, interim deputy medical director for primary care for NHS England and for NHS Improvement. Kieran, thanks very much. We look forward to your talk.
Thanks so much, and thanks very much for welcoming me here today. So yeah, as was just said, I'm a GP myself, and I work in NHS England, the primary care team, but I'm also one of the clinical leads for the long COVID programme as well in NHS England, and I chair the National Task Force for long COVID. And I've worked with some of you, I can see, because I can recognise some of your names on there. I've worked with some of you already around trying to develop the plan for long COVID for this year. So what I wanted to do today was, in fact, I might help you make up some of the time that we lost in the last session and in the break, because I don't think I'll speak for a full half an hour. I've just got a few brief sort of summary slides, really, of where we are in terms of the NH plan for long COVID, and really value your thoughts on it, really, and how you might feel you might be involved in part of this as well. So, Nathan, if you're able to flick to the next slide, and then the next slide, please. Thank you, lovely. So this is just a quick roundup, really, of where we were at the end of last year. So back in October of last year, there was a 5-point plan around long COVID that was announced. I won't go through this in detail, but just very briefly, the 5 things were about getting a definition for it, and NICE went about doing that. They published guidance last year. We then planned to set up assessment clinics, which we then went on to do. The third one was around getting patient information so that there was enough access through that, and we did that through the Your COVID Recovery website. The fourth one was about research, and the fifth one was about setting up the National Task Force, and that really is a way of getting together lots of different people's experiences and views on this, given that it's a new condition. None of us really knew at that time what it was and what we were dealing with. So we brought together professionals, researchers, patients, and many people together to come together and create a plan. So those were our 5 initial points, and things have moved on since then, which is what I want to take you through now. So if we go on to the next slide, please. This is a pathway that we've developed through the National Task Force, but also much wider than just the members on the task force. So we did a huge amount of engagement around this. We looked at the NICE guidance that was produced last year, and we also talked to professionals and patients and many other people to pull together all the guidance really that is out there to pull together this pathway. Now, we've always viewed this as an iterative process, because we're all learning all the time. But based on the knowledge we had when we were pulling it together, this is where we landed. So again, I'm not going to go through this in a huge amount of detail, but just what it does is on the left-hand side, it shows the patients coming from the community, most usually into general practice. That tends to be where they present. Having said that, you can see a box just above those people there where it does outline other ways that people might come in. So through community pharmacies, for example, and we know that pharmacies are often very well placed, particularly in areas of deprivation, to reach patients that practices can't necessarily as well. Patients might also access the NHS website, and so there's information on there. And patients may go through Your COVID Recovery and try and access information through there. So there are various portals that people can access, but one of them will be general practice. If they feel like they can't get what they need from those things, they might then access general practice. The boxes through the middle just go through what would need to be required in that setting. So assessment initially, as we all know, to rule out any other underlying pathologies, make sure we're not attributing it to long COVID when it's actually something else. But if long COVID is diagnosed, what happens then? So that's when you've got the box in the middle, where some patients might be able to undergo self-management and supported self-management through the practice team, through social prescribers, through health and wellbeing coaches, signposted into the community for peer support, and really, be able to manage on their own, but with that support around them. Others, however, may need further support or further investigations, and that's where you've got the box going downwards, and they may then be referred on into one of the post-COVID assessment clinics. From there, a management plan would be devised, and then treatment from there on, predominantly in the form of rehabilitation. that's that, I think, slide in a nutshell, but there is lots more detail on there, which I won't go into now, but do feel free to have a look at that further if you would like. So we go on to the next slide, please. So this is what I want to take you through, really. So we had that 5-point plan at the end of last year, and we've really developed that into much more, and we've now got a 10-point plan. And as I said, it's been a hugely collaborative process, taking into account so many different views from different groups and professionals and researchers and patients, because we wanted to develop this together. As I said, you know, we all know we're all learning all the time. We don't all have the answers, and we've got to pool all our knowledge to come up with a plan together. So these are the 10 points. If we just go on to the next slide, because I just wanted to pick out some of the key ones. They're all important, but these are the 4 that I wanted to highlight. So what we've done since last October, where we started with the website and we started with the clinics, we've now invested more funding to go into a few different things. So the first one there on this slide here is there's money that's gone into support general practice. Now, because general practice is most frequently one of the first ports of call for many patients in the community, we want to support our general practice colleagues. That's our GPs, our nurses, our pharmacists, our social prescribers, and all our other staff in that setting. We know that they have to do an initial clinical assessments. They need to have the right information and the right education around this new condition, but they also need to know what their local pathways are to then be able to signpost people into or refer people into. Many will be then supported more fully in the community setting with their social prescribers or other parts of the team. So they all need to be fully informed, really, of what's happening and what they can do to support these patients. The next box there along is around the assessment clinics themselves. Now, these assessment clinics have been set up so that they're multidisciplinary. We all know it's a multi-system disease. So in our commissioning guidance that we have set out, we have included in there that needs to be multi-specialty, multidisciplinary, so that all the different aspects of the condition can be addressed. And what we did last year was we initially started by having assessment clinics. And what we have very quickly learned is that assessment is great, but it's not just about assessment. It's clearly also about rehabilitation and treatment as well. So this funding has gone in to broaden out the definition so that it's not just about an assessment clinic, it's also about assessment and treatment. And that all needs to be part of an offer that is given to patients. The next box along, this is around paediatric hubs. So we know that adults are more commonly affected by long COVID symptoms than children and young people, but that doesn't mean to say that children and young people aren't affected. So we have also set up some specialist hubs as well around the country. When it comes to the adults, we've got 89 clinics now set up over England. But for paediatrics, we've got 15, given that the difference in numbers. Predominantly when it comes to patients, say, for example, presenting in general practice, if I as a GP think a child or young person has long COVID, I will do all the normal assessments to try and exclude any other diagnoses. And then in my particular area, I'd refer on to paediatrics, which is very similar in other areas. It's all very slightly different, but there are so many similarities too. So I'd refer on to the local paediatric service. But if further advice is required, more expertise on top of that is required, then these hubs have been set up so that those paediatric services can also tap into that specialist service too. The fourth box I wanted to let you know about is, well, I've really covered it, I suppose, in what I was saying about the assessment clinic. This is about the rehab pathway. And again, this is around the multidisciplinary aspect of it. So it's not just about respiratory, and patients will often say that to us, you know, this has been set up by respiratory. My symptoms are fatigue, or my symptoms are, you know, something else, they're not respiratory. And they're absolutely right. And so many of the clinics may have been set up by respiratory, which is absolutely fine, but we do know that they also involve other specialties as well, so that we are having that multi-specialty, multidisciplinary approach as well. Next slide, please, Nathan. And the next one. Thank you. So these are the 89 clinics I was referring to for adults. They're dotted all around England. So this is for England specifically, not the devolved nations, but for England, we've got these around the country. Now that we've set them all up, what we're trying to ensure is that there's some consistency in the provision. We want to make sure there's no sort of unwarranted variation in the offer that's being delivered. So we're working really hard with our regions, with our systems, to really get that consistent offer across all of them. The other really important aspect is the equity aspect. We've seen so many inequities appear over the course of the last 18 months with COVID, and we don't want to see that happening with post-COVID syndrome. So we're trying to ensure that both general practice, but also these assessment clinics and treatment offers are also equitably accessed for everyone who does need it. Next slide, please. I think I've pretty much run through this already and what I've already said, but this slide is really about expanding the post-COVID services. So I've gone into this already about the multidisciplinary aspect. The care coordinator, and point number 2, is really important. The information or the feedback we had from patients is that some people are being bounced around the system. We don't want that. We don't want people who bounced around and having to repeat their story all the time, and to not feel like it's streamlined. So we've introduced this care coordinator aspect so that it can be a more streamlined pathway. I won't go through all of that in detail, but that's essentially some of the main points that are in the commissioning guidance that we issued initially last year and then updated it. We refreshed it again then this year. Next slide, please. And next slide, please. It's another reiteration really of what I was saying. So this is the treatment aspect, not just the assessment part, but the rehabilitation part. Again, stressing the multidisciplinary aspect of it, but also drawing in what is already out there. So social prescribers, linking into community groups, making sure we link up with our voluntary sector as well. Our leisure sector could be really important in this as well, and trying to bring together as many people as possible. And also when I've spoken to pharmacy colleagues, we recognise that, you know, local pharmacies have a huge potential in this area. And what can we do with local pharmacies as well to spread the message, to raise awareness so that access is equitable, and also to signpost people in the right direction too. Next slide, please. And the next one. I'm not going to go into detail around this. It's just a bit more information. The slides will be shared, so please do have a read through if you're interested in these. This is just a bit more information about the children hubs that I had mentioned before. Again, only 15, not the 89 around the country, because not as many children are affected as adults are. The figures are there, the ONS figures are there in that box there. But what's really important about the children hubs, and what we're really keen to ensure when children do present, for example, in general practice, for example, we want to be sure that they are referred when they need to be referred and at the right time. So those who are already recovering and making good recovery, back to school, doing most of the things they can usually do, they might be managed with supported self-management. It's the ones who are missing school, you know, where there's a real impact on education, real impact on the extracurricular activities, and impact on just their daily living. That's when we worry about the children, and that is when we'd recommend that children do get seen either in the paediatric service initially, or then referred onto the hub if that is then required. But we really want to try and put the message out there of when children do need to be seen in these hubs. It's so important they don't miss out on all those other important aspects of life. And next slide, please. This is where the children's hubs are, just the 15 of them scattered about the country, again over England, and do feel free to have a look at that in a bit more detail. And the next slide, please. This is the pathway for children. Again, I'm not going to go through this in detail. It's very similar to the pathway I showed you at the beginning, but this is for children instead. The pathway is very similar actually for adults and children. It just diverts slightly when it comes to the post-COVID assessment at the end, whether it's paediatrics or adult. So I won't go over that in further detail. So next slide, please. And next slide. I think I'm almost towards the end of my slides here. So I mentioned as part of the 10-point plan, the support for general practice around the enhanced service that we've launched. 93% of our practices have now signed up, which is really good. And what that means is there'll be a lot of emphasis really on the educational aspects of it. So that central point there about all the symptoms that people might present with. So in general practice, you know, we're presented with symptoms all the time. So someone who comes to me with fatigue, you know, I need to be aware if they've had COVID or not, to potentially make that link, but also be aware of all the other conditions that might cause fatigue. There aren't the COVID related. So there's a lot of things I think that our practice teams need to have in their minds when they see patients with these types of symptoms. Next slide, please. This is just a brief summary of what the enhanced service includes. 3 points in the middle of the slide there. It's around the education, as I mentioned, making sure all our teams are educated around this new and changing condition. And it's education about the condition, but also being fully aware of what is there to support patients as well. And we have had feedback from patients saying, I went to my GP, they didn't know what to do, they didn't know where to send me or where to signpost me. So we're really, really keen that all our practices are well aware of that. And again, it goes back to my other point, that's not just practices, it's also community pharmacies, because that is another place, that is another port of call, that place that patients will come to and ask for advice, ask for information. So it's really important that everyone knows what is available. As part of the National Task Force, we've got a subgroup that is specifically set up for producing information and educational resources. And there are some e-learning modules, and the colleges are very much involved in that. And that's being developed. Some are already out there, more is already being developed. And NHS England, we're collating all the resources and putting it on the Futures website so that everyone can access everything that's there. The other part of the enhanced service is also around accurate coding. If we're going to learn more about this condition, we need to know who is getting the condition. We need to know about the demographics as well. So who is it affecting most? But also really importantly, and this relates to then the third point in the middle of that slide, is about the inequity aspect as well. So we need to know, are people accessing care equitably or not? And that is why the coding is particularly important. And if there are any inequities, how do we try and mitigate against that? So what can we all do to reach out to people? In practice, from a very practical point of view, what we'll be doing is talking to our patient participation group and asking them to try and spread the word through their networks of what is the condition, could you have it? And if you do, these are the types of help you could get. And working with local communities as well, like in the vaccine program, for example, when we were trying to encourage and support people to get the vaccine, we spoke to local community leaders, to faith leaders, and people really in the community could really spread the word. And it's the same for long COVID as well. How do we raise the profile and get people to recognize this as a condition and know what to do about it? Next slide, please. That may be my last slide. Yes, it was. So that's it from me. So thank you very much.
Thank you very much, Kieran. Again, open for discussion, questions, and thank you for getting us back to time. So maybe I can start off, Kieran. One of the things is this is a new disease, as we've heard, and we need to do. There's a lot of research that needs to be done. And one of the sort of points on your slides was that it is important we do undertake research. And you're setting up all these services. How are they linking up with the researchers, and how can we make sure that people who are coming to the NHS clinics have access to the potential research studies, which is very, very important?
Yeah, so as part of the National Task Force, we have many different subgroups. I mentioned one around education and information, but another subgroup is the research subgroup, and they are very much linked in to the research that is going on. Some people here may even be part of it or linking into that, because what we're really keen to do is, exactly as you've said, as research comes out, as we learn more, how does that then get linked into day-to-day practice? Because that's the most important thing. It's not just about research for producing a paper, for example. It is actually about how do you then implement it. So we have that subgroup, and it is very well linked into people who are very much involved in that research. So we're always hearing of the latest, and then as things come through, we can then start using it and start implementing it.
Sure, I fully understand about the importance of research into implementation and application, but actually we need the patients to be recruited to the studies to take part in the research. And do your clinics actually help in terms of the recruitment and so on into studies?
Yeah, well, many of our people on our task force are professionals who run clinics themselves. So many of them are very much involved in recruiting and doing their studies within their own settings and then feeding that through. So a lot of the information that we get, I mean, there are different types of studies, aren't there? But certainly some of our professionals are doing their own work in their own clinics, and they bring that richness with them to then the groups that they come to in our group. And then there are the more formalized, bigger research studies, which are also ongoing. And as results come out from that, that will be fed back to us as well. And then we can work out how we then go on to implement those.
Great, thank you. Philippa.
Thanks very much. That was really useful. Just a quick question on the building awareness of the services that are available. I'm involved with my local Health Watch, and I wondered, I know they're getting a lot of inquiries about sort of long COVID. It's sort of building up. Are those resources you referred to something they should be aware of to help with signposting?
Yeah, absolutely. So we're working predominantly with National Voices, and National Voices are coordinating a lot of the other groups, a lot of the third sector and other groups like that. So Health Watch should be linked in with them. And I would have hoped they would already have access to those. If they don't, of course, we'll signpost them to the website. As I said, on the Futures website, everything's been collated and put on there. So if they're not already aware of that, then absolutely we need to link them in quickly. And it might be through National Voices that we do that, because they're the ones coordinating it all. But yeah,
brilliant.
Absolutely.
I'll check with Charlotte Orks. Thanks very much.
Fantastic.
Eddie.
Yeah, Kieran, that was really very interesting. My question, I guess, relates to, as well as helping GPs understand long COVID, does some of this funding go some way to help them deal with what's coming up in the winter, for instance, other respiratory infections, flu and RSV, etc.? Is it helping a broad awareness of the impact of viral infections and health coming up?
So that enhanced service I was talking about was purely long COVID related. I think what you're highlighting a whole other issue. Autumn and winter is going to be a challenge across the whole of the health service. That's inevitable. And so there are other things separate in a way from long COVID that are very much around supporting in that regard. Yeah. So they're not really they're not the same. Everything I've just described very much long COVID related, but you're absolutely right. And I think that's the difficulty with all of these things, isn't it? When we're asking colleagues in the community or anywhere in the health sector, here's another thing that you need to now do. It's in addition to everything else that everyone has to do. And it's really hard. It's really tough. And that's partly why actually we developed the enhanced service, because we could have chosen not to and said, just get on with it. But actually, we didn't feel that was right. We wanted to support, we wanted to pull together the educational resources. We wanted to give guidance around the coding, how to reach out to people and provide a bit of capacity to do that. So we're trying to take the stance of, this is hard, it's going to be really hard, but here's the support we can give you to really enable you to do it as much as possible.
Thank you.
Thank you. Can you say a bit more about the coding, that in terms of what general practitioners are supposed to do with the coding? How sort of deep does that go? Is that just one sort of code, or are there many different codes and so on?
Yeah, so first of all, just say there's coding across both general practice, but also in the clinics. And it's really important that we get coding all the way through so that we can see the patient journey and which services people end up in. So that's really important. The other important thing to say is, through all that data collection, irrespective of the site that it's collected from, it's also being broken down by demographic as well: age, sex, ethnicity, deprivation. So we get a really good feel for which patients are coming through. In terms of the general practice codes that you just were asking about, there is more than one code. So there are I think it's 4 or 5 main codes, but essentially, we haven't coded it as long COVID because, as we know, NICE say it's ongoing symptomatic and post-COVID syndrome based on the timing. So those are 2 codes. We've then got another one for referral to a post-COVID assessment clinic, because we want to know who is being referred. I mean, we can pick that up through other means, but it's a neat way of doing it if it's coded in the notes. And there's also another one about signposting to your COVID recovery website as well, because we want to know how many people are being signposted on appropriately. And if we see that people aren't being coded like that, and just for example, if the numbers are really low, it might give us a chance to come in and say, well, is that because people don't know about it? Do we need to do a bit more of a push on the comms to get the message out there, and that sort of thing as well? So there are several codes in general practice, not too many. We don't want to complicate it because people won't use them if it's too complicated, but there are those 4 main ones. There's one final one as well in general practice, which is long COVID has resolved. It's a resolution of it, and I think different people have different views on that one because it's a fluctuating condition. So when is it truly resolved? But the reason why we included that one is because some patients don't necessarily want it on their record forevermore if their symptoms have all gone, you know, and there are implications, insurance implications. For example, you don't necessarily want it still on there if your symptoms have gone. So that's the 5th code. So we've tried to keep it quite simple, and then it will help us to gather the information we need to then guide what services we need, and also potentially the resource implications that might be required as well.
Great, thank you very much.